Authorities tend to focus on the immediate damage after a hurricane, but a new study looks at what happens years later and raises questions about long-term health risks, especially for older adults. CBS News national environmental correspondent David Schechter joins us now with more. David, always a treat to be able to see you. Talk to us a little bit about exactly what this study found.
Thank you so much. You probably recall Hurricane Sandy sitting there in New York from 2012. Massive storm smashed into the mid-Atlantic states, including New York City, notably. And for 5 years, this study followed nearly 300,000 people over the ages of 65 who lived in areas that were flooded during Sandy. They found that those people that lived in previously flooded zip codes had an average of 9% higher risk of death, even 5 years after the storm. And we're not talking about physical injuries. Researchers found that these people were impacted by damaged infrastructure, by disrupted care, and the kind of slow burn stressors that can take a toll on older individuals. So the bottom line here is that it raises serious concerns about what happens in the aftermath of a disaster, especially for older adults who may already be dealing with other compounding health issues, and they may have limited mobility too.
Yeah, I find this is so important because it really gets at the ripple effects of all of this long after people stop paying attention. Right. Did you get the sense that this was a blanket finding? Were these results consistent everywhere, or did perhaps some places see larger impacts, bigger impacts than others?
Yeah, definitely. There were some nuances in there. Big regional differences in the Atlantic coast there. Connecticut saw the largest increase of older adults in flooded areas that had a 19% higher risk of death, which is astounding. In New York City, the risk rose 8%. But then in New Jersey and parts of New York State, the study didn't find any significant changes at all. So it's a little bit of a head scratcher, but the researchers are saying that the factors like infrastructure and local policies and recovery efforts could help explain, because they're different in different areas, how some areas saw bigger impacts than others.
So maybe there's something to be learned from that in those regional differences, because, I mean, what's the takeaway here when it comes to future storms?
Yeah, I mean, really, it's a warning that disaster planning can't end when the storm just passes. It obviously carries on. Climate change is driving more intense hurricanes and more frequent flooding events. And older Americans who already face more health challenges may need better long-term support than they're getting now. The study's authors say this kind of risk doesn't show up in daily death counts, but it is obviously very real. And in our warming world, planning for recovery needs to be more local and more tailored and thinking more long-term.
Yeah, an important study, and this is an important conversation. David Schechter, thanks so much for being with us.